do your research and learn about the things, about the issues and the nuances that happens behind those labs where you are not allowed. Hello ladies, welcome to the Shepherd's Wife. My name is Utsa. My goal here is to encourage and help you think biblically about motherhood, womanhood and women in ministry. So welcome. Hello everyone and welcome back. I have been away for quite long, but I'm back, so thank you for being here. Before we go to today's video, I just want to give you a disclaimer that I'm not an expert, I'm not a doctor, I'm just an ordinary Christian woman who is concerned, and more importantly, I'm interested in knowing things biblically before we take any important decisions in our life, to see through the lens of Bible, that see how God sees it. And then this is one of those topics where there are a lot of ethics and moral issues and questions that arises, and want to just give few heads up, like maybe you may not be aware of some of the moral and ethical questions that you have to go through if you are thinking to go through this process of IVF. And yes, I'm not an expert, but yes, I have watched hours of videos where during my research of this topic, where the experts who have been an IVF practicing doctors and who have left it, and also the couples who have undergone IVF, their experiences and how they see it now, some of the things that they had to deal with, some of the questions that they had to deal with. I'm not an expert, but I did my homework, so I hope this will help you. So today's topic is, as you have seen already, that should Christians opt for IVF? Recently I went to my parents' place, and then on the way to their home, the first advertisement, the first banner that I saw was the banner of the advertisement for IVF. And I think it has become very acceptable and very common these days that one or the other person you will hear in your neighborhood has done IVF, undergone IVF and had babies through IVF, or is trying to opt for an IVF. So it has become quite common now. Recently, one video just popped up, and then shorts, and it was just showing how the fertilization takes place, and then how the embryos are created, and then boom, at the end, the doctor is holding two babies and says, "Take happiness home." So that's how it's marketed, and then that's how it is becoming more and more common and acceptable. But there are things that are not shown in these advertisements. There are issues and questions that are not dealt in these YouTube shorts and all, which I would like to address in this video. So what is an IVF? IVF is non-vitro fertilization, which literally means fertilization in a dish, in a glass dish where it is performed. So if the couple has been trying for 1 year and they are not able to conceive, then they are like considered infertile, and then they go to these IVF clinics and hospitals. So what they do is, for about 2 weeks continuously, daily, woman is injected with hormones, fertility medications, and it can be 2 weeks or it can be more, depending on the cases of different women and their health and their needs of their body. So they're injected daily. It allows a woman to produce more eggs and then mature. After this injection process is over, instead of letting them ovulate, what they do is, it's a minor procedure again, where you are sedated with mild anesthesia, and then vaginally, through the help of needle, those eggs are removed. It is also called retrieved, and it is taken to the embryologist, who selects the mature eggs, and that is physically injected with live sperm, which is taken from a man, of course, and then that's how the fertilization takes place in a dish. So that's what it is, in vitro fertilization. What happens after that is, if you see the next day, most of the eggs will be fertilized. Like they say, it's about 80% of those eggs will be fertilized successfully. And now it's not eggs anymore, it's embryos, it's living being, it's a complete another person with all unique DNA. If you have seen my previous video about when the life begins, so these all fertilized eggs are now embryos. Within next 3 to 5 days, if it's a fresh transfer, then what they do is they will take these embryos in a frozen state, and then they will transfer it to the uterus of a woman. And usually it's not only one embryo, but 2 to 3 up to 4 embryos are also transferred sometimes, because there is a high chance of miscarriage. So what they do is they want to take more options, they want to give it more chance. So if not all 4, at least 1 or 2 will be implanted in the uterus. So this is how it is performed clinically. And the rest of the embryo, so now you have implanted about 4 embryos, the rest of the embryos are frozen for future use. So that's how it is done in IVF, and I think you all who have been through or who are considering, you know this process. So that's how you are trying to consider this, right? But when we say IVF, we run into some ethical and some very serious moral questions that usually the doctors, I think, will not inform you about, and even our churches, we do not talk about much, because we don't think, I think that it is important, or it matters. But as I study it more, and as I listen to people more, their testimonies, I have seen that there is a need to talk about this in our churches among women and couples, and because it does bring a big problem, and the question of Christian ethics, as I said, as you all also know, 2 to 3 or up to 4 embryos are transferred to woman's womb for implantation. But I don't know whether the doctors here in India will tell you, but of course in the West, they tell them that, we have fertilized this many eggs, and you have this many embryos, and then you can use it in the future. So what happens is, usually doctors will not fertilize only a certain amount of eggs. They will fertilize almost somewhere between 10 to 15 eggs, which means, so you have now 10 to 15 embryos leaving babies in those dishes which are frozen. So when you transfer few, and there is also again a lot of problem that it goes into that, you implant, you transfer 4, and then 2 implants, and then 2 will be like miscarried. And sometimes you run into some other problems like selective reduction, which I will talk about later. So there's a big question here, that what will happen to the rest of the embryos? What about those babies who are frozen indefinitely, or who are destroyed? Because there are only 3 options that you have with these leftover embryos. First, either you implant all of it, and then you try to give birth. But if we see it humanly, it may not be possible right now, because 10 to 15 babies and then you giving birth, I think it's physically also not possible these days, and then it is not safe for a woman's body and for those babies too. And second, what option you have with those embryos is, you keep them in ice, in freezing for like indefinitely, or as long as like you can keep them, because it also has expiry date, right? Or the third option is, you either destroy them. So destroying embryos equals to abortion, killing, murder, because those are living babies. So if you are a Christian, a believer, and you believe in that life begins at conception, and to know that we don't have to go to even Bible, that life begins at conception. Science proves you that life begins at fertilization. So that's the question. And there is one more option, that these days, some embryos, it's taken by the hospitals and those embryologists to do some eugenics, some experiments, and to check some genetic things and all, and ultimately they test them, and then they destroy them. So what about those innocent children? Because those are your babies, right? So this question is there, and forget about the health risk for the mother and the babies have through this IVF. But apart from that, this question of what about those babies, what will happen to them and who will fight for them, because they are just there frozen. I have heard testimonies of couples, Christian couples, who went into IVF without thinking much, without considering much options, and then when they already implanted now for embryos, it's implanted, and then you have now four babies and you don't want to have any more, and then you are done, or you develop some sickness or cancer or some life-threatening disease where it's not possible for you to have any more children. So then they realize the seriousness of this issue and the question that now we have left another 10 embryos, our babies, in the fridge. Now what are we supposed to do with that? And that question hits them after they are done with it. So please consider these things, because I can understand this the longingness to have a baby, and it's a good desire because it's the desire given by God. God in the beginning itself gave us the blessing to multiply. Multiplication happens through babies. So I can understand the desire and the longing, and it's painful. I have many of my relatives in my family who are dealing with this, who are trying to conceive baby for many years, but they are not able to. I have my close friends who have dealt with it and are still dealing with it. So I know the pain and the struggle. Your pain is real, I know that. But I also want you to consider the question of right and wrong, because when it's like IVF, it is like you are the client. Nobody is talking about those babies. Everybody is talking about the happiness of the parents and making your family whole, bringing happiness home. But what about the happiness of those children who are still frozen, because they are already living being? I want you to consider these things before you opt for it. As I said before, I will talk about selective reduction. So this is another problem that the couples run into after implantation of the embryos. So usually, I think you have also seen that, and you have also heard about somebody in your locality or in your church or in your society that they went through IVF and they have twins. So usually, not all the time, but usually they have twins or even triplets. So this is because doctors, they want to give the embryo the maximum chance to implant. So sometimes one baby will implant, one embryo will implant, and the others will not, and they will be miscarried. So to avoid that, what they do is at once they will transfer up to 3 to 4 embryos. Usually it's 3 or even 2, but up to 4. And they expect that at least 1 or 2 will implant, even if not all. So but sometimes in many cases what happens is all the 4 embryos implant, and the woman is pregnant with 4 or 3 babies. But again, it's not very practical to have 4 babies at once. Sometimes, maybe in rare cases, but not every time. And sometimes the woman has issues because she has already taken so many hormones. The body is already whacked up, and then this is not a normal pregnancy, right? It's like you are injected with a lot of hormones and your body is prepared with the medications. So you already have so many issues, and then you have this heavy pregnancy with like 4. So what the doctors will suggest is you do selective reduction, which even the name itself is like so heinous, wicked, that you have to choose among your children. It's like you have in your womb, so 2 boys and 2 girls. So you want to go with 2 boys, or you want to go only with 2 girls, or you want to go with 1 boy and a girl, and then rest. Your term is reduction. So you reduce, you have 4, but now you can reduce your children to 2. So, I mean, what logic is that? And then how would you take that, getting, being pregnant with 4, and then you knowingly, you you have to make a decision to keep two of your babies and then let go of two. So these are the heavy hard questions that you are thrown usually into IVF. And then many couple, I'm sure that you will not know this, many women, they don't know this. I want you all to consider serious questions before you go through this process of IVF. Let me talk about the risk, the health risk of IVF to the mother and the babies. I was listening to one of the podcasts of a doctor who does IVF, and he was saying that many women are, even not only before the implantation of the embryo, that you have to be given some hormones, but also during the pregnancy, since this pregnancy was not conceived naturally, there are certain hormones like progesterone. So those hormones are to be given till up to some months, up to like second trimester or few weeks, depending on the body, the health of the woman. So you are like injected with so many hormones that it just it just makes your body so crazy. And then even without injections, or without injecting yourself with hormones, even if you are just taking some birth control pill or some medications that helps with your hormones and all, you already have so many side effects. And during IVF, like, your body has to prepare for pregnancy, which naturally is not happening. So there is already so many stress going on, there is so many internal hormonal changes that goes through, and which leads to stress and depression, and then emotional mood swings and all. And these are all studied risks that are there. And there is also risk of high stillbirth in this kind of cases. And also there are risk of diabetes and hypertension. And in some, it's not confirmed yet, but there are some studies happening, research in science that shows that there can be some high risk of cancer developing later, those for the ladies who undergo this IVF. I'm not saying to scare you, but I just want you to keep these things in mind. Sometimes before you go through these things, IVF, your doctors even prescribe you with contraceptive pills, birth control pills, which also has a lot of side effects. So your body is already going through so much that it will show up someday. I cannot imagine like what these women who go through IVF will go through, taking all these hormones and all, because hormones are very important for our bodies, and it controls a lot of things, and it changes a lot of things in your body if it's slightly less or more. So because I also had hypothyroid, right now I'm cured, and then I'm fine. But when those hormones kick in, or it's not making enough, then your body just acts crazy. Researchers have already shown that there are so many side effects of that, and I'm sure there will be. I was very surprised to know that IVF is not 100% like the results. In India, I was seeing the statistics, and it's somewhere between like 45 to 55. It might go up in the future, they are saying, but still maximum is 55% of chances to have a positive result, yani pregnancy through IVF. So it's not 100%, which I think many people think that if they go through IVF process, it's going to be 100% assured result, but it is not. And there are also risks that happens to babies who are born through IVF, like I said before, stillbirth. There is always a high risk of stillbirth, and babies who are born through IVF are more they have more risks towards having autism and having tumor and cancer in future. And also they might have some birth defects. I'm not saying every baby who are born are like that, but there are high risks that those babies will have these certain risks to them. And the greatest risk that these babies have is the risk of human human error or lab errors, because there is a lot happening in the lab while you're waiting for your baby, the embryo, to be transferred, because they have to be kept in a certain environment and certain temperature, and there's a lot of freezing and thawing, those process keeps going on. So there are a lot of cases where there have been errors, where accidentally the embryos have been destroyed because of the imbalance of the temperature. And sometimes when it's frozen and then it's thawed, many of the embryos, it doesn't implant when they are transferred to a uterus, because while they are transferring on the process itself, the embryo thaws before it should be, and then it dies. There's a very high level of human error, the risk through human errors and lab errors, where your babies can be destroyed even before you are given them in your uterus to be implanted. So these are the risks that you need to consider for yourself and your future babies. Are you willing to go through these things, and are you are you willing to put yourself and your babies in risk of so many things that can go wrong? So what can be the solution? You must be saying, I am so desperate for a child, a baby. So I will say, there is no definite answer that, okay, if you do this, then it is more ethical, or it is much better, or you do this, because I'm nobody to give you that answer. It's your decision. But what I have heard and learned about is that, if like you go through IVF, there is like few things that you can consider which can be more ethical, but yet still it has those risks that I have already talked about. Risk will be always there, but there is more ethical way to do this, as Christian couples, if you are thinking to go through this process of IVF. So it is like you do not make embryos more than what you are planning to implant. Like if you are thinking to have 3 babies, then you let your doctor fertilize, you let the embryologist fertilize only 3 embryos, and thinking that all of them having the good intention, that all pure intention to implant them all and then to have all live births, not thinking that oh, I have 3, but maybe one will implant and rest might be destroyed, not going with that attitude. So you implant every embryo that is created, and do not have the option to destroy them or give them for any lab experiments, because if you believe that it's your baby, then you have to be considerate, because every child deserves the chance to live. I heard recently about another option, that you freeze your eggs, and then because eggs are not yet embryos, it's just the eggs that are there. So you freeze the eggs of the woman, and then you implant every time, and you fertilize only 1 or 2 at a time when you want to transfer and implant them in your womb. So that is another way. They say it's and I feel like, yeah, that is more ethical, but still I want to say that there are a lot of risk and nuances involved even in those decisions. Be wise to decide for you and for your family, what is best and what is biblically right, what is ethically morally right, that you don't kill those babies knowingly or unknowingly, and be informed and talk to your doctor. I feel like when we go to doctor, most of the doctors don't answer your question. They don't want to answer, because I don't know why, but they are like, okay, this they will see your reports, and then they will prescribe you medicine, and you're out of their clinic. But go to doctors who are willing to talk to you, who are willing to go through your health issues and then talk to you about it, and you can ask questions. I don't like doctors who do not like to be asked questions. And when you say, oh, I read this about this in internet or somewhere, then they will be like, oh, their attitude will be, I know better than you, I'm the doctor. Of course they are the doctors, but you do your own research. Everything is available in internet, and so many informations are there, experts are there, podcasts and YouTube videos are there, where there are lot of talk about this issue and even other issues which you think is troubling you. You can have your own study, and then when you go and meet your doctor, talk to them and ask questions. There is another better option where you don't have to think about these questions, and then you don't have to deal about any ethical issues or moral issues. There is one area of medicine which is recently developing, and then many of those doctors who have left IVF, they are pursuing this restorative reproductive medicine or integrative gynecology. So before you go for an IVF, please consider this and search and research about in your area if there are any doctors practicing this. What it is in this practice, in this gynecology, what they do is they try to search for the root cause of the things that are happening in your body, infertility and all, and they try to find the solution naturally, where you don't have to undergo and all this sort of things. So it is a holistic approach where they deal with your mind, body and soul. All three things are considered, and then your food habits, your lifestyles, your hormonal imbalances, if there is any endometriosis problem, if there is any PCOS, or if there is any insulin resistant problems. So they deal with all these things in this gynecology, restorative reproductive medicine. So please search for that. And one of the proponent of this medicine, this gynecology, is Dr. Lauren Rubal. I will put link in the description where she talks about this, and then you can listen to her, and then try to find and search for the doctors who will walk through you in this process. And this alternative way is more cost friendly. It's less expensive, it's less intensive, it's less aggressive, and it's less invasive. Like IVF is very invasive. I cannot tell you my shock when the first time during my first pregnancy, the doctor did the physical examination, and I found, like, I still can remember that it was so traumatic and so horrified I was. So very invasive, and IVF is like triple, four times much more invasive than normal pregnancy examinations and all, because you have to be always there to retrieve eggs, and then again you have to let them transfer the eggs, and then so many other stuff that you go through, where you are on doctor's table all the time, letting them in and out through your cervix. So it sounds and looks very invasive. Hope that this new line of medicine will help many women to consider natural treatment for infertility, and that you will find that kind of doctor and who will help you through your this difficult time. I also want to say, give yourself grace and give yourself time. It is said that after this new integrative gynecology treatment, many couples within 1 year or after 2 to 3 years, there is a high chance that they conceive. So please give yourself grace, give yourself time, don't rush, because these days doctors, they are, I think, very easily they give you the option for IVF. They don't want you to wait for long, and I can understand the age, the fertility age of a woman. If you are passing, you are already into that that end period of your fertility, then it might be of a concern, but still you can work through that. And because the IVF is, we have to know what it is. It is a billions of dollars business right now, and doctors and medicines, they are earning a lot of money through this process. So it is easy for those who are not concerned for your health, who are not concerned for those unborn babies, and especially if your doctor happens to be someone who do not know Jesus, who do not know Christ, who do not know Bible. For them it is not a life, it is just a clump of cells, and they will happily destroy it for you if you say I don't want it, or there is some problems. So be considerate yeah, of that. It's very commercial, and don't flow away with the flow of people who are doing it, or the advertisements and the ads and the vlogs and all, what no matter what in social media you see. Be very wise in deciding about this. It is ultimately your decision, of course, but as Christian couple and as a Christian women, we need to give consideration to the unborn babies, because life matters to God and life should matter to us. I also want to say that if you already have gone through IVF, don't feel guilty about it. And if you have a baby who is born through IVF, I want to tell you that that baby is as of equal value of any other baby who is born naturally. There is no discrimination, or there is no devalue or less value of that baby just because the baby is born through IVF. So please keep this in your mind and heart, and it's not devaluing of you as a mother or parent. And this video is just to inform those parents in future who are considering this. And then because I don't want you to go uninformed, I don't want you to go unresearched and unsurveyed. Do your research again and again, I would like to say, and learn about the things, learn about the issues and the nuances that goes through that happens behind those labs where you are not allowed. I would like to recommend especially two people. You can go to Ellie Beth Stuckey, who hosts a podcast Relatable. She has her own she has a whole playlist on IVF, surrogacy, and infertility, all those stuff. So you can go and watch. She talks with experts. She talks with many of those who have undergone this IVF. So there are like interviews of those Christian couples who have done it, and then how they feel about it, and what they will not do and what they will do now, those kind of thing. And also Lila Rose, who also has a podcast and a YouTube channel. You can watch in her videos also, that when she talks about IVF with doctors and experts. And also there are many other resources online. Please go through them before you go to the IVF doctor, so that you don't go uninformed, that your mind and your heart is clear that okay, this is what I'm going to go through, and this is what I'm up to, and I'm prepared. So all I want you to be is to be prepared. So before leaving, I want to leave you with a short message and a Bible passage. But before that, I want to say that I understand you. Some of you women, if you are struggling through this, you must be thinking, oh, she already has children, how will she know my pain? How will from where she is coming and then instructing me not to go through IVF because I deserve a child. And then I can understand that, and I know your suffering, I know your pain. I may not know the pain and the suffering of an infertility or barrenness or childlessness, but I do know suffering, I do know pain. I have seen things in my life which has been painful, very painful, and then I know what it is to have a desire for something that you really wanted for, and that you really want, and that you have been praying for, but to see it just slip away from your hand, every day, every week, every month, every year. So I feel you, and then I can understand, and I will pray, every time, since I have seen so many people in and around me and in my family, so many of my close relatives and close ones who have been going through this period of infertility and childlessness, that it's like it has become one of my prayers to pray for each and every woman who and the couple who are going through this, because I know I can sense and I can feel their pain. And I just want to say, after trying, because I said IVF also is not 100% sure that it will give you. So adoption is a very good option if you are willing to, and it will give you a chance. It will give chance to those kids who are without parents, orphans, and then if that is only and only if you have that option in your plate. So please, yeah, go through that, and even Bible supports that. But still, if you go through so many, if you have gone through all the treatment, you have done everything that it's in your hand, and even IVF you have tried, and if it had not worked, then I want to leave you with a message that God wants you to know, and that God's heart is for you. That he, first thing is that he understands you, because he's the giver of life. So if he is withholding this from you, from both of you, you and your husband, then see the picture where, see the purpose behind it. Try to see, I know it's difficult, but there is always purpose behind everything that happens in our life. And then God is in control. We have to believe that God is sovereign, and then if you believe that he is sovereign, then nothing is out of his hand. Every single thing that happens is in his control, and then he controls everything, even your life, even the babies that we will have in future. I want to leave you with this encouraging verse, which encourages me all the time. This always encourages me when I desire something, when I go through pain and suffering. This is from the book of Habakkuk, chapter 3, verses 17 and 18. It says, "Though the fig tree does not bud and there are no grapes on the vines, though the olive crops fail and the fields produce no food, though there are no sheep in the sheepfold and no cattle in the stalls, yet I will rejoice in the Lord. I will be joyful in God, my Savior." So this is saying, even if I have nothing in my life, even if I desire for this and this and this, even if I wish to do this, or even if I wish to have this in my life, and if I don't get it, and if I don't have it, if I just see it going away from my life, if I just see it slipping away from my hands, and even if I never have a child or a baby, yet I will rejoice in the Lord, because he is the joy, and he is sovereign, and he knows your pain, because Jesus went through all the pain and suffering for you. So he knows your suffering, he knows your pain. So I want you to be encouraged. I pray and I hope that you will be able to say that whether you have a baby or you don't have it, you still say that, "Yet I will rejoice in the Lord, yet I will be joyful in the Lord, my Savior." God bless you all.